Welcome to the generic Royal Air Force Nurse Recruitment Presentation. You would have by now watched the general presentation delivered by your local Armed Force Careers Office, and this presentation aims to build upon that information, specifically relating to the Royal Air Force Medical Services and the Defence Medical Services. Keep in mind the information covered in this presentation is a tool for you to continue your own research into your chosen role and the Royal Air Force as an organisation. All the information is relevant to your application. However, watching this presentation does not commit you in any way. For over 100 years, the PMRAFNS have gone where others cannot go, giving care in the air. Alongside our Armed Forces colleagues, we have kept our forces fighting fit, and we are proud of all we have achieved. Life as an RAF nurse is exciting and offers fantastic opportunities, both personally and professionally. It's our pride, esprit de corps, cohesion and winning spirit that unites us. The PMRAFNS motto, Nec asper terrent, nothing shall deter us, epitomises the RAF nurse. The Chief of Air Staff Strategy describes in detail how the Royal Air Force plans to deliver air and space power over the next few decades. One element of that strategy is Astra. Astra is the campaign to build our next generation Royal Air Force, and it has 4 core themes: people, training, infrastructure and support and equipment. It applies equally to everyone who works in or alongside the RAF, delivering air and space power to protect our nation. You will need to be able to demonstrate an in-depth knowledge of the role of the Royal Air Force, be able to define air power and understand how the Royal Air Force plans to tackle threats in the future, specifically looking at their assets, platforms and its people. Defence as an organisation is split into many subsections. You will need to have a good awareness where the Defence Medical Services fits into the wider armed forces. Defence Medical Services falls under the umbrella Strategic Command, who in Defence are responsible for preparing our forces for operations, our education, training and future planning. The primary role of the Defence Medical Services is to promote, protect and restore the health of all service personnel so that they are ready to deploy operationally wherever and whenever they are required. There are approximately 7,600 uniformed medical personnel within Defence Medical Services, 3,600 reserves and 2,200 civil servants providing healthcare to over 145,000 service personnel. Defence Medical Services encompasses the entire medical, dental, nursing, allied health, paramedical and support personnel. This includes both primary and secondary healthcare, as well as rehabilitation, mental health services and specialist areas such as occupational health and overseas. Throughout the UK, the Defence Medical Services are responsible for 12 regional rehabilitation units, 5 joint hospital groups, which are embedded in acute NHS trusts, and 14 military-run departments of community mental health. In addition, they are responsible for major permanent overseas bases, including the Falkland Islands, the Ascension Islands, Gibraltar and Cyprus, to name a few. Defence nurses include members of the Army, Navy and Royal Air Force. Often working closely at home and on operations, each service still maintains their own identity, traditions, culture and ethos. Defence nurses are highly qualified and skilled healthcare professionals who deliver the very best nursing care wherever they are working. This could be in arduous and challenging operational environments such as Afghanistan, on the back of an aircraft or more traditional clinical settings such as an NHS ward. You will note that the nurses in this picture are holding rifles. It is important to state that although we are classed as non-combatants, we are trained in how to use a weapon safely. This is to enable us to protect ourselves, others and our patients. At the end of the day, you are joining the armed forces. Royal Air Force nurses are unique in the fact we can work on any platform. We can work on hospital ships, in field hospitals and in the air, whereas our sister services cannot. We are the only service which performs the aeromedical role and who are trained in aspects of aviation nursing. If successful with your application, you'll be joining the Princess Mary's Royal Air Force Nursing Service, fondly known as the PMs. This is still part of the Royal Air Force. Formed in 1918, Princess Mary, who was King George V's only daughter and our current Queen's aunt, agreed to become our royal patron in 1923 after years of supporting injured servicemen during World War I. Our current patron is Her Royal Highness Princess Alexandra, who is the Queen's cousin. Sitting at the head of our branch is our Matron-in-Chief, or Director of Nursing Services, which is a rotational post for a group captain nurse, which changes every few years. RAF nurses wear distinctive tricorn hats, which again is unique to this specialist branch. The first recorded RAF Aeromed flight was in Somaliland in 1919. The aircraft was modified to carry a stretcher and attendant. You'll be pleased to hear that we have come a long way since then. It was recognised at this time that aviation and flying presented new physiological and pathological problems which required a separate medical service. The RAF Medical Services was born, followed shortly by the Princess Mary's Royal Air Force Nursing Service. The service was female only until 1980. Although we mainly work in joint hospital groups, primary healthcare facilities and overseas locations, our reason for existence is aeromedical evacuation. Ultimately, it is about getting the patient from one location to another by air to the final receiving hospital or place of safety. The level of care and equipment in flight mimics that of any NHS facility. This not only meets the needs of defence, but also the moral component of fighting. It ensures that our sick and wounded personnel, dependents or entitled civilians are returned home in the safest and quickest manner when needed. A great comfort, I'm sure, to those who are perhaps serving in conflict areas. There are over 2,500 aeromedical moves a year, with 30% of these moves being unescorted, i.e. no requirement for medical intervention or a medical escort. This photo shows a C-17 in 2010, ready to move a large amount of critically ill patients back from Afghanistan, the largest ever recorded move. This picture shows a critical care team and a patient on the back of an A400M Atlas. Each critical care patient requires in excess of half a tonne of kit, but the aircraft enables all-round patient access in relative comfort. Here we see the air transportable isolator in use on a training exercise. Again, note the amount of space available, even more critical when nursing this type of patient. The operational role of the RAF Medical Services is to support the patient care pathway from the point of wounding or injury back to the UK. We do this through a variety of deployable medical treatment facilities that mirror the care they would receive in the UK. NATO use the terminology Role 1, 2, 3 and 4. The Role 1 is a deployable medical centre that provides primary healthcare services, immediate emergency care, resuscitation and triage. The medical treatment facility is fully scalable and can be mission tailored for smaller detachments or when there may be host nation support available. Within this pathway, there are 3 distinct phases: forward, tactical and strategic. As the casualty moves through the chain of evacuation, there will be more sophisticated levels of care and more medical personnel. RAF nurses can work at any part of the evacuation chain. The pre-hospital care squadron is responsible for setting up the Role 1 facility, providing prolonged field care to deploy personnel and all forward moves. At the point of injury, the Medical Emergency Response Teams, also known as MERT, usually via helicopter or ambulance, will extract the casualty and treatment commences immediately. They will then transfer the injured to the Role 1 hospital where life or limb-saving surgery can be performed. Once stabilised, the extraction will continue to the Role 2 or hospital staging unit where further procedures can occur. The hospital staging unit is coordinated by the deployed hospital squadron and is a scalable facility designed to hold and treat patients in preparation for strategic aeromedical evacuation. The hospital staging unit is capable of resuscitation, enhanced and intensive care, damage control, and can perform stabilisation surgery prior to ongoing evacuation. It can also facilitate the clearance of other deployed hospital care facilities, which enables them to receive further casualties. Up to this point, it is still classed as tactical aeromedical evacuation, as it is still within the theatre of operations, but could be some distance away from the initial casualty collection point. Moving on to the Role 3, the Role 3 provides secondary healthcare at theatre level. This facility must provide all the capabilities of the Role 2 and be able to conduct specialised surgery and provide any additional services as dictated by mission and theatre requirements. The UK Role 3 may provide CT scanning but does not have the means to independently produce oxygen and could be reliant on oxygen cylinders. Finally, the Role 4 has the full spectrum of military healthcare, including highly specialised capabilities such as reconstructive surgery, prosthetics and rehabilitation that cannot be deployed or will be too time-consuming to be conducted in theatre. Role 4 medical support is a national responsibility and normally provided by hospitals in the casualty's country of origin, but not always. For example, in Optelic, the military hospital RAF Nursing in Cyprus was utilised. When performing tactical or forward moves, the following aircraft are normally used: the Puma, the Hercules C-130 or Chinook. These moves occur intra-theatre within the country and are usually up to 40 minutes maximum. Choosing the type of airframe depends on several factors, including the location of the patient, the severity of the patient, the number of patients, available aircraft, host nation support, and the terrain. You can see from this picture that the working conditions are very challenging. Limited space, increased noise, increased vibration, and poor patient access, making every medical procedure such as IV access, patient assessment, and communication more difficult. Once safe to do so, the final strategic aeromedical evacuation occurs, and this is usually returning the casualty to the UK. The Royal Air Force have a number of aircraft that can undertake strategic flights, including the Voyager, the C-17, the Hercules and the A400M. These aircraft can travel longer distances, allow us to carry more equipment, transport more patients and give us the option to augment our medical teams where needed. Conditions in flight are much more comfortable, including allowing the patient to sit or to utilise a stretcher, as well as all-round patient access. The configuration of our strategic aircraft can be changed easily to accommodate the type of patient, i.e. whether they are sitting or require a stretcher, the number of patients and their clinical dependency. The only exception is the Voyager, which must be configured at RAF Nursing. You are taught how to configure aircraft on your Aeromed course, which at some point you will all complete. Our headquarters for support, preparation and force generation for the entire RAF Medical Services is Tactical Medical Wing based at RAF Nursing. TMW for short provide the expertise to prepare and support the wider RAF Medical Services for operational deployments and has a central role in the delivery of high readiness support to worldwide operations. It is made up of 5 squadrons. Number 1, the Aeromedical Evacuation Control Centre, also known as AECC. Number 2, the Aeromedical Evacuation Squadron. Number 3, the Operations Squadron, also known as DARTS. 4, the Training Squadron, and finally the Capability and Sustainment Squadron. In addition, 4626 Reserve Squadron are co-located here with 612 Reserve Squadron based at RAF Lucas in Scotland. The Aeromedical Evacuation Control Centre is the UK point of contact and coordinators of all Aeromed moves. Nothing happens without this team. They decide the team makeup, they liaise with international hospitals to obtain all clinical information, and they can influence the type of aircraft used. They raise all the paperwork, including the patient movement requests, and categorise each patient depending on clinical condition. Each patient is given a priority, which is how quickly this patient needs to be evacuated. They are also given a class, which is whether they are sitting, require a stretcher, or are a mental health patient, and finally a dependency. This is how much clinical care they require in flight. Ultimately, AECC aim to get the patient back in the quickest, safest and most cost-effective manner. The Aeromedical Evacuation Squadron provides continuous support to military and entitled civilian personnel during peace, crisis and war, moving patients within the aeromedical evacuation system. Critical Care Air Support Teams, also known as CCAST, are also available to transfer seriously wounded, critically ill or highly infectious personnel. Note we do not have any children's nurses within our medical services, but we can augment this speciality if needed. Both CCAST and the Air Transportable Isolator have an on-call rota, with various states of readiness to move. Once trained, you could find yourself working on a squadron or as part of one of these teams. The Operations Squadron consists of nurses, medics, paramedics and doctors who deliver a wide spectrum of pre-hospital medical support for operations and exercises. The Deployable Aeromedical Response Team Squadron, DARTS for short, provides short-notice aeromedical evacuation and primary healthcare in a Role 1 facility. They also undertake forward aeromedical evacuation as part of the Medical Emergency Response Team and conduct routine tactical and strategic evacuation. They also support humanitarian disasters and often cover military exercises and cover parachute drop zones in the UK, US and Kenya. Recently, DARTS deployed on Op Rumen, the hurricane relief operation in the Caribbean, where they were one of the first boots on the ground setting up and running a Role 1 medical treatment facility in 2017. The Training Squadron provides pre-employment and pre-deployment training for all RAF medical personnel. Every nurse will eventually undertake the aeromedical course. However, you will need to be autonomous in your clinical practice as you may undertake independent flights, therefore you need to be confident in your primary role first. During the Aeromed course, you will learn how flight and altitude affects the body and how this may alter the care you give to your patient. You will be taught how to raise the relevant paperwork, learn how to roll the aircraft and learn about the different types of aircraft, including how to evacuate safely. When performing the Aeromed role, you actually make up part of the aircrew. Therefore, you need to know all the safety aspects of the aircraft you'll be working on. You will also be taught how to use the specific Aeromed clinical equipment whilst undertaking written and practical assessments. The course is a mixture of classroom and practical activities with final consolidation flights with real patients. Finally, the Capability and Sustainment Squadron. No one can go anywhere without this squadron. They are responsible for the maintenance and provision of all medical and field equipment, which is required for us to undertake training, operations and exercises. Most of the equipment is modular, which means any combination can be sent wherever it is needed quickly. It includes everything you need to set up and maintain the facility, from TEDs to beds to drugs and medical supplies. There are no nurses on this squadron. Personnel include medical supply officers, environmental health technicians and pharmacy technicians. The Royal Centre for Defence Medicine, based within the Queen Elizabeth Hospital in Birmingham, is our Role 4. The primary receiving hospital for all our operational casualties. Purpose-built in 2010, in excess of 600 military staff work there. It provides secondary and specialist care for all members of the armed forces and has a dedicated training centre and a military research department. It has its own Aeromed cell, which enables the quick assessment of patients by the correct speciality and provides enhanced welfare support packages. Military multidisciplinary team meetings and military ward rounds are also a weekly occurrence. Set in an ideal central location, it enables quick transfers from Birmingham International Airport, where if clinically needed, casualties will have a police escort to prevent delays. We have many RAF nurses working within Defence primary healthcare. The UK is divided into 6 regions, each with their own chain of command, which could be Army, Navy or RAF led. Within each area, the medical centres are generally run by single service leads. Primary healthcare facilities, or medical centres, look after the health of all service personnel and in some areas dependents and their children. Nursing care in this environment is wide and varied, treating ailments and conditions which are similar to the greater population. In addition, you are ensuring every service personnel is fit and ready to deploy. Nurses are involved with treatment clinics, preparing personnel for deployment, signposting, governance, training and emergency airfield crash cover. Primary healthcare nurses are also deployed overseas to permanent operating bases. You don't have to be pre-qualified to work in this setting as full training is given. Throughout Defence, our military population have access to 14 departments of community mental health. The RAF are responsible for running the ones listed on this slide. The department offers one-to-one care, group sessions and referral to other services. Nurses can be deployed operationally and work at TMW on the Aeromed Squadron. All inpatient care is seconded to specific NHS hospitals and beds can be accessed at any time. Mental health nurses must be trained in this speciality prior to joining. However, there are numerous further education pathways available once serving. The original World War II pilot rehabilitation hospital at Headley Court, Surrey, moved to Stanford Hall in Loughborough in 2018. Stanford Hall is a state-of-the-art tri-service establishment which focuses on all elements of rehabilitation. Providing inpatient and outpatient care, it manages a wide range of injuries and conditions not necessarily caused by conflict. Patients with neurological conditions, complex orthopaedic problems, or patients who require a short course of rehabilitation due to sports injuries are all catered for. It also has a highly sophisticated and world-leading prosthetics department. Along with a multitude of rehabilitation specialists, doctors, physiotherapists, exercise instructors and psychologists, nurses make up a proportion of the multidisciplinary team, and this too is a place you could work. Based at RAF Henlow, the Centre of Aviation Medicine, or CAM as it's commonly known, is the lead in aviation medicine on behalf of Defence. It is the main point of contact for advice and training, as aviation medicine requires specialist medical and scientific support in the recognition of those conditions brought on by or amplified by operating in the air environment. Within CAM is the hyperbaric chamber. This piece of equipment allows pilots and aircrew to experience and understand and recognise the signs and symptoms of hypoxia. You may get to experience this on your aeromed course. There are plans for CAM to move to RAF Cranwell in the future. The centrifuge, a world-leading simulator that enables pilots to experience the many effects of G-force on the body, moved to Cranwell in 2019. There is currently a research post for officers at CAM. We will now move on to where you can work as an RAF nurse. Nursing in the RAF does not just give you the opportunity to be treated, trained and supported as a professional, but the flexibility to work in different clinical specialities, delivering cutting-edge military medicine. The RAF employs nurses in a wide range of general and clinical specialities. It invests heavily in its people and professional training, and funding is available to continue to develop your practice up to master's level. You can also expect to deploy on operations and be involved in exercises and contingency operations. There are many opportunities to work outside of nursing in other roles, such as training or education. By working closely with your career manager will ensure you enhance your profile, develop and gain the required skills. It is likely that you'll initially be posted to a joint hospital group. There are 5 tri-service joint hospital groups located throughout the UK, each having their own command and control structure. Although the commanding officer may be Army, Navy or RAF, there will always be a senior RAF nurse located in each area. Joint hospital groups are located in North Allerton, Portsmouth, Plymouth, Frimley Park and the Royal Centre for Defence Medicine in Birmingham. We also have critical care nurses working at the John Radcliffe Hospital in Oxford and burns and plastic nurses working at East Grinstead in Brighton in order to gain a very specific skill set. There may be potential in the future to expand to clinical areas in other locations to further enhance specific skill sets. Joint hospital groups are embedded in acute hospital trusts, as it is critical for us to gain and maintain our acute nursing skills in preparations for operational deployments. RAF nurses work within all acute areas, and this is where we need our skill set to be. Currently, the areas are emergency medicine, critical care, medical, surgical, burns and plastics, trauma and orthopaedics, infection control, and theatres. I encourage you all to read the publication A Force for Inclusion Strategy 2018 to 2030. As well as the clear moral case for action, diversity and inclusion is critical to Defence's ability to safeguard our nation's security, stability and prosperity. A diverse and inclusive organisation is stronger, healthier and more resilient, and the Royal Air Force seeks to harness a diversity of thought, skills and talents within society. The Royal Air Force recognises people's differences and values and what each individual can bring to the service. Embracing equality and opportunity and the right to be treated fairly, there is no tolerance for bullying, harassment or sexual harassment in the Royal Air Force, and those found guilty will face disciplinary action and potentially termination of service depending on the outcomes of an investigation. This concludes our presentation. Thank you for watching.